We do not offer icing before botulinum toxin injections, Botox, Xeomin, Dysport, Jeuveau, Daxi, nor do we recommend that you ice before you have injections. And it's not because we're mean and we want you to be in pain. It's because there are two serious side effects from icing before these injections. So if you think about why icing works, it's because it vasoconstricts or clamps down on the blood vessels and decreases blood flow to the area, which yes, can help with bruising and pain, but when you have less blood flow, that means that there's going to be less of the neurotoxin taken up by the receptor. So meaning it's going to be less effective. And if we did like 20 units in your glabellar frown lines, maybe you only absorb like 16 or 18 of those units. So you're getting a subpar result. That's the first reason we don't offer it. The second reason is a rare but serious side effect of any of those units that are not taken up at your receptor. They get washed away in the extracellular fluid, meaning that they can be systemic in your body. Now, when we're doing small cosmetic doses, it's usually not a big deal, but if you think about really big medical doses, the more botulinum toxin that's washed away in your system, the more likely you could be to have systemic effects or side effects like Botox flu, for instance. If you've never heard of that, it's essentially flu-like symptoms from having botulinum toxin injections. Now, that's going to be more common with neurotoxins with complexing proteins like Botox, Jeuveau, Dysport. Xeomin, it's less likely, and to be determined with Daxi, which is new on the market and does not have complexing proteins. But if those proteins are floating around in your system, your immune system recognizes them as foreign and creates an immune response. And so that's why we don't want that floating around. So we do not offer icing because we don't want the medication to be less effective, and we don't want you to get side effects systemically like Botox flu.